Hey there everybody, we're here to cover the important topic of episiotomy. So I'm going to get the most questions I can answered for you in the next 5 minutes, rapid fire style. Let's get that 5-minute timer started now. What does episiotomy mean? So episiotomy is when your care provider uses medical scissors to increase your vaginal opening during the pushing stage of labor, so making a cut. What is cut during the episiotomy? So the perineum is cut, which is the muscular area between the opening of the vagina and the anus. Are episiotomies common? So this really depends on where you are giving birth. The episiotomy rates greatly vary by country to country and can even vary by doctors within a practice. The current number in the US falls kind of around 12%, but it can really vary. Are episiotomies necessary? So in some cases, episiotomy is recommended to speed up a difficult delivery. For example, if there's fetal distress, baby's not tolerating that end of labor pushing stage. But best evidence does not support routine use of episiotomy. Are episiotomy stitches dissolvable? So yes, the stitches used to repair an episiotomy are called dissolvable sutures, or they're also called absorbable sutures. Now this means that they don't need to be removed by your care provider, and usually within the next 2 to 4 weeks, they are absorbed into your skin. Is episiotomy painful? So the pain is often experienced during the healing of an episiotomy, and that healing process can last for a few weeks. Some things you can do is put ice pack, could put a pad soaked in witch hazel, and then you might need some pain medication during that process. How episiotomy stitches heal? So the best way to help them heal is to keep the stitches clean by changing your pad frequently, using a peri-bottle, squirt bottle when you pee, and also patting yourself dry instead of wiping. That'll help heal. Which is better, episiotomy or tear? So you're more likely to suffer complications with an episiotomy than with a tear, and also the injury to your tissue, research shows us that it's likely to be greater with an episiotomy than if you just allowed your body to stretch and naturally tear. Can episiotomy done without consent? I hate this question because my answer is yes, that it can be done without consent, but it shouldn't be. Your provider should get consent from you before doing episiotomy. And even if in the case of fetal distress, it's a very quick conversation, that really should be a conversation that's had. But even before that, having conversations with your care provider so they know your thoughts about it would be really important, and I think recommended. Can episiotomy heal without stitches? So stitches or sutures are really necessary in healing an episiotomy. Some tears can heal without stitches, but an episiotomy is a significant cut. Can episiotomy stitches open? So episiotomy stitches should not open. If you notice redness or swelling or discharge or pus or bleeding, you should contact your care provider as soon as possible, because that could be a sign that the episiotomy is not healing correctly. Can an episiotomy be avoided? So the first step to avoiding episiotomy is really to speak with your care provider about it prenatally. So ask questions like, how often do they do an episiotomy? For what reasons would they perform an episiotomy? So get that conversation out in the open earlier. And if you see or hear that your doctor has a high rate of an episiotomy, maybe you consider changing, or maybe that's not the provider for you. But also, you can add a line to your birth plan that you would prefer not to have an episiotomy, and then talking to whoever's there to catch the baby and reminding them in person that you want to avoid an episiotomy, and if one is necessary, that you need to get consent before that happens. Are episiotomies bad? Episiotomies can be an important procedure for the health of the baby or the person giving birth. However, they're not recommended as routine medical procedures during a vaginal birth. And I would say not following research and performing episiotomies when they're not necessary would be considered bad by many people. Okay, episiotomy with your first baby, is that necessary with a second baby? So not necessarily. Okay. Okay, we got a lot of questions answered in 5 minutes. Hope that you found that helpful. 2 more quick rapid fire 5-minute videos for you. Make sure you check those out now and subscribe to the channel for more great videos like this. Talk to you later. Bye guys.